You're listening to me, Sally Pandian, on Chennai Live 104.8 FM. This is Metro Mornings right here, 8 a.m. sharp on the clock. And we're on this segment of Spotlight. And on Spotlight with me, I have Dr. Dinesh Jothimani with me in the studio. Doctor, thank you so much for joining me and welcome to Metro Mornings.
Hi, thank you for the invite for Chennai Live.
Yes, definitely. Doctor is from Dr. Rela Institute and Medical Center. We're going to find out more. Stay tuned. This is Chennai Live 104.8 FM, the coolest radio station in the city. This is Chennai Live 104.8 FM, Metro Mornings with me, Sally Pandian, on this segment of Spotlight. And with me, I am joined by Dr. Dinesh Jothimani here in the studio. Doctor, once again, thank you so much for coming by and, spreading a lot of things that we need to know about. Welcome, Doctor.
Thank you very much,
Right, so today, a lot of times we don't really understand, or should I say, we don't know the importance of what a liver, plays in a human body. So guide us through that, Doctor. How important is the liver really?
Liver is the largest solid organ in the body.
Mm-hmm.
It's inside the abdomen.
Mm-hmm.
I would say it's a factory of the body,
mm-hmm.
and it's a master organ, otherwise called,
mm-hmm.
because it deals with a lot of functions.
Yeah.
Whatever we eat,
mm-hmm.
it gets metabolized in the liver,
mm-hmm.
and the important building blocks of the body is the protein,
mm-hmm.
and most of the proteins in the body are formed in the liver.
Mm-hmm.
Say, for example, if you eat any food,
mm-hmm.
it gets absorbed in its simplest forms and goes to the liver,
Okay.
made into a complex form of the
Alright.
protein.
Alright.
Likewise, the carbohydrates, what we eat, gets metabolized in the liver and then used for storage and the energy purposes.
Right.
And likewise, all the fats are formed in the liver.
Uh-huh.
So this is important to understand that, because liver controls the metabolism of the body, and you have carbohydrate, fat and protein metabolism controlled by the liver.
Uh-huh.
And overall, these are the main functions, but
Mm-hmm.
there are almost close to 500 functions the liver performs,
Right.
sort of at micro level.
Right.
And the one other important function of the liver is to detoxify substances.
Mm-hmm.
Say, for example, liver is close to the gut.
Mm-hmm.
Therefore you're exposed to a lot of bacteria
Mm-hmm.
from the small bowel, from the large bowel into the liver.
Yeah.
And the liver role is to filter these bacteria. Otherwise, imagine if the bacteria gets into the bloodstream,
Yeah.
you're going to cause infection and sepsis. So the other main function of the liver is to detoxify these bacteria and neutralize toxins released by them, and also from the food particles. Actually.
Right. It is a very important role. For those of you tuning in, I'm in conversation with Dr. Dinesh Jothimani here in the studio. Well, stay tuned. We'll find out more. This is Chennai Live 104.8 FM, the coolest radio station in the city. This is Metro Mornings with me, Sally Pandian, right here on Chennai Live 104.8 FM. We're on this segment of Spotlight, and I'm joined by Dr. Dinesh Jothimani right here in the studio from Dr. Rela Institute and Medical Center. Once again, Doctor, we're talking about liver and its important roles that it has to play in the body. But what are the different diseases, liver diseases, that we may or may not be aware of, Doctor?
Yeah, that's a good question actually, because liver can be affected by a number of various diseases. Say for example, if you eat a wrong food, I told you it goes to the liver, and that gets metabolized in the liver, and
Right.
some of the metabolic components can be toxic to the liver.
Right.
And at the same time, if you get some viral infection, that goes to the liver, and then that virus can affect the liver. So the most common cause of liver disease, we divide the liver disease into acute and chronic liver disease. The
Okay.
acute hepatitis that's what it's called. Hepatitis means the liver is inflamed.
Right.
The most cause of acute hepatitis is viral infection, which comes through contaminated water and contaminated food. So they are hepatitis A and hepatitis E viruses, and most of them are self-limiting viruses. They cause jaundice, they cause vomiting, abdominal pain and fever. They usually last for a couple of weeks, and then eventually they subside. Very rarely in the immunocompromised patients, where the body immunity is less, these viruses can cause problems. And rarely in pregnant women, hepatitis E can cause trouble and liver failure, etc. But overall, these viruses are very much self-limiting viruses.
Yeah.
And imagine if you take a drug, an antibiotic. Most antibiotics are metabolized in the liver, and of course they can cause reactions, and that can affect the liver badly. So those are called drug-induced liver injury.
Right.
So these are mostly self-limiting infections and inflammatory diseases. But what is important is a chronic liver disease. Chronic liver disease that persists for more than 6 months. That's what we define as chronic liver disease. And the most common cause nowadays we are seeing is fatty liver.
All right.
Before that, we need to talk about hepatitis B and hepatitis C infection, which were common diseases in the past, but now because of excellent therapeutic measures and antiviral drugs, these diseases prevalence are coming down.
Yeah.
So hepatitis B and hepatitis C are bloodborne viruses, and they predominantly affect the liver. In Chennai, if you see, it's around 4% of the population carry hepatitis B virus, and around 1% carry hepatitis C virus, and mostly they cause chronic hepatitis. And most of them, the sad part is, most of them don't know they have the virus. They carry the virus for a number of years before the liver causes trouble. It takes usually around 20 years or 15 years, depending on their immune power.
Right. So it's important to also keep a track of the symptoms, which is what we're going to be talking about very soon. Stay tuned. You're listening to me, Sally Pandian, on Chennai Live 104.8 FM. I'm in conversation with Dr. Dinesh Jothimani from Dr. Rela Institute and Medical Center. Stay tuned. This is Chennai Live 104.8 FM, the coolest radio station in the city. You're listening to the segment on Spotlight on Chennai Live 104.8 FM. This is Sally Pandian on Metro Mornings, and with me I am joined by Dr. Dinesh Jothimani here in the studio from Dr. Rela Institute and Medical Center. Doctor, just before the break we were talking about the diseases of the liver, but you were talking about how a lot of people are not even aware that they're carrying these things. So what are the symptoms that should blink a red light when we see one?
Yeah, I mean, we are talking about chronic liver disease here. The more major, because the liver is a huge organ, and it has a huge potential to regenerate. So it self-regenerates actually. Okay. So therefore, whenever there is an injury, it tries to compensate by regeneration. So that's the reason why most patients do not have any symptoms, unlike many other organs. Say, for example, if you have a kidney problem, kidney stones, it immediately presents as fever, or you can have blood in the urine like that. Whereas liver problem do not cause any symptoms until late in the disease.
Right.
Okay. Once the liver disease progresses over a number of years, we are talking about 15-20 years for hepatitis C, hepatitis B, or even fatty liver for that sake. And the first symptom usually it's about tiredness.
Okay.
But as you know, tiredness is so common.
Exactly.
And we cannot attribute tiredness to liver disease all the time.
Yeah.
Okay, so that is something you need to think about it whenever some patients have tiredness. And the other symptoms very particular to liver disease are jaundice. When they develop jaundice, that means the liver function is deteriorating. So that means they need to go to the doctor to find out why they have jaundice. Most of them only then they get diagnosed with this is hepatitis C infection, or this is a fatty liver related advanced disease. When the liver disease progresses, the jaundice develops, as I told you earlier, and also the protein production. I told you liver is important organ for protein production. The protein production comes down. When the protein production comes down, the patients will develop leg swelling and fluid in the belly, and they start feeling unwell.
Right.
That's called ascites, the development of fluid in the belly actually. And when there is fluid accumulation in the belly, obviously they are not going to eat properly because they always feel full. Eventually they become malnourished. And also the protein from the muscles get utilized to compensate for the body requirements. So obviously they get a lot of muscle wasting because of this. And they bleed a lot because liver is also production house for coagulation factors, the clotting factors. So therefore they bleed a lot. They can vomit blood. What happens is when the liver becomes cirrhotic, where the liver lacks the regenerative capacity, the blood flow to the liver is under a lot of pressure. So the patients develop a lot of what you call as abnormal blood vessels around the foot pipe, around the stomach, like that. So what happens when the pressure increases? These blood vessels rupture, and patients pass black motion. And this is one of the emergencies we come across.
These are quite difficult to miss. These are some of the most very obvious ones, should I say?
That's right. So that's why we always say when the liver disease causes symptoms, it's advanced. This is the point I'm trying to say. At the earlier stages, liver disease hardly causes any symptoms. Patients can be completely normal for a number of years.
Right.
even present cirrhosis per se doesn't cause any symptoms,
Right.
except little bit of tiredness, and and as I told you, we cannot always attribute tiredness to
We can't,
liver
yeah.
cirrhosis. Yeah.
Yeah, in fact, there's a lot we can do about it to avoid these diseases, which is what we're going to be talking about very soon. Stay tuned. For those of you tuning in, I am in conversation with Dr. Dinesh Jothimani right here in the studio. Stick around, let's find out more. You're listening to me, Sally Pandian, on Chennai Live 104.8 FM, the coolest radio station in the city. You're listening to me, Sally Pandian, on Chennai Live 104.8 FM, Metro Mornings right here. And on this segment of Spotlight, I'm joined by Dr. Dinesh Jothimani here in the studio. We're talking about liver diseases just before the break and the symptoms as well. What do we do, doctor, to keep away from them? What are the certain things that we can avoid doing in terms of this?
Yeah, I mean, most of the liver diseases these days are lifestyle inflicted diseases.
Yeah.
Okay, so therefore lifestyle changes are the key management issues when it comes to the treatment of liver diseases. When I say lifestyle, fatty liver is the most common cause of chronic liver disease these days, and they can present as liver failure as well as liver cancer. So the simple way to prevent that is adequate exercise every day, and a diet that is optimal diet in terms of not loading yourself with the heavy carbohydrates. And unfortunately, most of the Indian meals are filled with carbohydrate high dosages, so therefore a diet which is pretty less in carbohydrates, high in protein, that's what probably I would recommend for most people. And because these days we don't do much sort of physical activity, most of our jobs are sedentary, we need to accommodate your diet accordingly. And of course you need to take an extra effort to be physically active, and that should be part of your life actually. And most liver diseases, not only liver diseases I'm talking about, even you can prevent your diabetes, prevent your heart problems
with our lifestyle choices.
Absolutely, yeah.
Talking about lifestyle choices, I would like to cover certain things that I'm pretty sure people wanting to hear. Certain elements like choices of living, like say alcohol. How much does it affect this particular issue?
Yeah, alcohol is predominantly metabolized in the liver actually, and excess alcohol is injurious to health. Alcohol in low or moderation, it's supposed to be acceptable, but I would say better to avoid, because our people don't know what the limit is, and particularly youngsters who I see here are predominantly involved in binge drinking, which means they just drink over the weekends non-stop, day and night, and that's more injurious to the liver, because you're loading your liver with a huge amount of toxins. So that's what I would recommend actually. Low amount of alcohol is because in the West people do have alcohol a little bit every day, but they never cross the limit. But crossing the limit is an issue.
Is on a blurred line right here in Chennai,
indeed,
and that has been contributing. We've been finding so much about this particular issue. Doctor, thank you so much for joining me on this studio and revealing all of these facts that we might or might not have thought about, but reminders like this are very important. For those of you tuning in, I've been in conversation with Dr. Dinesh Jothimani here in the studio from Dr. Rela Institute and Medical Center. Thank you so much for joining in, Doctor. I hope to catch you on the show very soon.
Lovely. Thanks very much for the interview.
Definitely.
Bye-bye.
Well, stay tuned in. This is Chennai Live 104.8 FM, the coolest radio station in the city.